Substance use disorder epidemics are complex adaptive issues. They're not just a technical response. And so it really requires an integration of efforts. And that's what preparedness officers are good at doing. So I think there are several areas, I think of at least 4, where there are just core competencies of preparedness offices that really affect how we do response to the opioid epidemic and these large, complex social issues. I think those include partnership. I mean, preparedness is all about partnership and relationships before the event. We do partnerships both in terms of in-house and with external partners. And we've also tried out different partnership models through preparedness. So we've had staff that have been embedded in our preparedness office. And we've done that now with other entities for our opiate response in West Virginia. Second area I think of includes our response infrastructure. A lot of folks are using their incident command systems or their other coordination systems to respond to the opioid epidemic. And so I think that organizational structure is really helpful that we can apply to a different model in a different situation. The funding channels. Often our preparedness offices are funding channels for emergency response funds, for supplemental funds. It was critical with CDC's crisis funding that came to West Virginia that allowed us to hire staff rapidly through partnership agreements and to begin to build our infrastructure to respond to this epidemic. And so that has been critical to get our response up and running and then to transition that into longer term positions under our Data to Action grant. And with substance use, what we say and how we say it matters. It's as much about risk communication and the ability to let people know that you care before they care what you know, and that you really have to think about how you communicate this work. We watch it evolve now as we get closer ties with behavioral health. And that's really such an important piece to really understand those partnerships there. We have used our preparedness staff a lot in coordinating event responses such as our hepatitis A outbreak response. We used our incident command structure, support systems. That was a critical piece for hepatitis A. It's been critical for our HIV cluster investigation as we support the EPI office in that response. We're using it now related to looking at youth vaping to kind of facilitate the partnerships and the work groups that can create recommendations moving forward. There's lots that states can do to prepare. And I think first to realize it's about more than opiates. It is really about substance use more broadly. And you need to think about systems of care for substance use and systems of prevention for substance use. So I think that emphasis on more than just opiates is really critical. Training around substance use disorder as a disease and the science of addiction is so critical because there is so much stigma around mental health disorders, around substance use, and we hold it within ourselves unknowingly. And so I think making sure our healthcare systems, our staff, our communities really understand the science of addiction is really critical. And also the language that we use, so that we are clear that we're not using language that stigmatizes the disease further. I think a second way that you can prepare is thinking about what kind of organizational system might work best for you. And then I think the last area I would touch base on is to really think systems and integration of care. These are systems of care for addiction that you have to think about the spectrum from prevention to long-term recovery. We have focused so much on the response piece that we sometimes forget to really expand that, both in terms of all the way upstream to true prevention in communities, to all the way downstream in terms of sustaining recovery for a lifetime. And so I think that integration of care and those systems of care for addiction and realizing it's much beyond opiates is really critical. You know, I think there's opportunity in the preparedness world to really think more fully about resiliency. And reality is that stronger, healthier communities every day equates to substance use disorder prevention. And it strengthens our response capacity as well. And so I think really understanding resiliency and what impacts it, and that attention to community functioning every day and to social connectedness in communities that allows people to come together around issues can really be key. Public health is all about helping individuals and families and communities live to their fullest potential, to thrive. And substance use disorder and epidemics of opiate use, et cetera, gets in the way of that, both individually and at the community level. So it is something we have to address together. And preparedness offices are good at pulling folks together to think through issues, at really looking at the deeper issues underlying. And so I think we have opportunity to use that as one resource within our health departments to better integrate the work that we do every day into public health.